CoreLink Siber SI joint fusion system consists of compression and non-compression styles and features a fully porous 3D printed implant with nanosurface technology. Sizes are available in diameters of 9.5, 11.5, and 14.5 millimeters. Screw lengths range from 30 to 110 millimeter and 5 millimeter increments. Optional 3D printed washers are available in all sizes. It is important to locate the sacral foramen using fluoroscopy prior to inserting any guide wires into a patient. The lateral SI fusion surgery is performed using fluoroscopy in the lateral, inlet, and outlet positions. After markings are made on the skin in the lateral view, a 2 to 3 inch incision is made and a guide wire is placed in the most superior part of the SI joint, inferior to the L5-S1 end plate. Insert the guide wire after locating the posterior sacral wall and sacral alar line via fluoroscopy. The wire should be placed approximately 1 centimeter away from the posterior wall and inferior to the ala. Ensure that the radiolucent guide wire impactor is placed on the wire to prevent damage when using the mallet. Insert the number 1 dilator over the guide wire and use the depth markings to measure the implant length. Ensure that the dilator is contacting bone and not caught on soft tissue prior to taking the measurement. Additional dilators may be used to sequentially dilate the incision site. Not all dilators are required for smaller diameter implants, as shown in the table on the left. The dilator handle is placed onto the largest dilator just below the proximal ridges and 2-finger tightened from the bottom of the handle. If desired, a plastic tissue shield can replace dilator 1 to test for nerve impedance. Remove all dilators except the largest, which has the handle attached. The implant length measurement tool can be placed into the proximal end of the dilator with the guide wire positioned in the middle of the block. Be sure to use the appropriate side for dilator 3 or 4. The proximal end of the wire will denote what length implant to use. At this step, the guide wire can be lengthened by using the reverse threads to stack the guide wires. Next, choose the drill for the appropriate diameter screw and, using a T-handle or power adapter, drill to the distal end of the first guide wire. Remove the drill and harvest the bone graft from the drill flutes. This graft will be packed into the implant before insertion. Next, the site can be tapped with the respective implant diameter tap. If desired, decorticate the joint by rotating the rasp 360 degrees around the guide wire inside of the joint for additional joint disruption. Place the implant into the graft pack block and pack implant with the harvested autograft into the fenestrations. Use the stab and grab inserter to insert the implant over the guide wire. Slide the implant down the placed guide wire through the dilator and begin inserting the implant until the laser mark on the inserter shaft meets the proximal end of the dilator. Place the variable pin guide over the guide wire and set the desired length. Recommended implant spacing can be found in the surgical technique guide for various implant combinations. Use imaging to position the second guide wire based on the first. Feed the bone funnel over the implant, remove the guide wire, and finish packing the implant using the supplied tamp. Repeat these steps for implants 2 and 3. To learn more, go to CoreLinkSurgical.com.